Hi, I'm Deborah,
And I'm Lawrence.
and in this video we're going to talk about what to do when you can't afford depression treatment. Um, the thing is that if you have untreated depression, getting it treated should be a priority, because the problem is if you're depressed, everything else kind of goes downhill. If you work, you are going to have trouble doing your job. If you're looking for work, you're not going to present yourself as the best candidate. If you're in school, things are not going to, obviously, it's going to be difficult to get assignments done. When I first got treated for depression, the insurance company refused to pay for the treatment for 18 months because they judged it a pre-existing condition, because at one point my doctor had put down that I seemed stressed. So they used that as an excuse not to cover the treatment. So what I had to do is I went to a mental health clinic that operated on a sliding scale, and I wasn't making a lot of money, so I didn't pay a lot of money. So I got therapy and I got medication through the clinic. So the medication also was low cost. That's when I first was diagnosed with depression. That's what I faced.
I've been lucky enough to be able to. We have insurance now that is, they're not gonna do something like that, luckily.
No. Although we did, for a while, the university was not, went to a different mental health provider. And it was pretty bad because we were looking for a therapist for you, and the therapists that were available on that plan, that were willing to take that plan, generally were not the best.
No.
The problem is, again, if you run into something like that where you're kind of getting this cut rate coverage, at least you're getting something, but you may have to make it better by taking some steps. And we'll probably deal with that in a future video about what's not acceptable in depression treatment, and what you can do about it. So the first thing is obviously getting diagnosed, and that's the first step to getting treatment. So there are a few options. Now, obviously, if you live in a rural area, it might be hard to take advantage of the options that I did with going to a mental health clinic that operates on a sliding scale. But getting that diagnosis is essential. So even if you have to, drive 2 or 3 hours one time to get the diagnosis, a lot of the follow-up visits can be by internet. So it's important to have your diagnosis be by a qualified, responsive doctor.
You need to have a diagnosis that is done by a good doctor who knows what the hell they're talking about.
Yeah, definitely. So you're going to want to see a psychiatrist if possible. If you have a family doctor who you feel is responsive and responsive and caring and knowledgeable, then that's kind of like that's a fallback option, because they can prescribe medication, especially if you're lucky enough to have a family doctor who actually is really interested in mental health, probably done some reading and stuff. Then that's another option. But so try the mental health clinic that operates on a sliding scale option. One way, if you talk to your doctor and they don't, in the way that I actually got this, hooked up with this, is I talked to my family doctor, and he called the head of the mental health clinic at this hospital, and that's how I got set up. But what you can do, if you just are not really sure where to look, is you could call your local hotline, their mental health suicide hotline. And there might also be other like nonprofit agencies and stuff that that provide information about this. So that's a really local thing, so it's hard to get specific. But in general, you should be able to find some information online or through your doctor about low cost clinics or clinics that operate on a sliding scale. Obviously, also if you are on Medicaid, then that's something, or a state program, that's like Medicaid. Then you might be able to to get mental health treatment through that. So one of the things that people, once they're diagnosed, run into the biggest problem as far as cost is medication. Or if their insurance company for some reason is screwing them over, and which happens a lot. So there are some ways to get free or low cost medication. There's something called prescription assistance program that's been around. It's actually been around a long time, and what it is large pharmaceutical companies actually cooperate. It's hard to believe, but to give free medication to people
or low cost.
Yeah, to people who qualify. Mm-hmm. So there's actually you can probably get information from your doctor, but also there's a webpage online called Needy Meds, which is kind of a clearinghouse for these programs. There also are some state programs that you can find that basically do the same thing. They facilitate the link between you and the prescription or the pharmaceutical companies. So so obviously with all this stuff we're including the links below, but so that's one option. The other option that you should always take advantage of when you see your doctor is asking for samples of your medication, and be honest with your doctor about your financial situation. This is no time to be embarrassed.
It's not going to help to not tell them the truth.
No. Remember that your doctor gets free samples all the time from pharmaceutical reps. Okay, so I've had doctors giving me stuff even when I didn't need it. Here's you're on this medicine. Here, I got some samples of this. So make it clear to your doctor and also their support staff that you want to be in line if there's any free samples coming. One thing to be aware of with the prescription assistance programs is it can take a long time to go through the process. So you want to get that started as soon as possible. In the interim, this is when you definitely would want to talk to your doctor about samples. Kind of a last resort, or definitely a last resort, is what's called pill splitting. Lawrence and I both are aware of the problem when you are not at full strength in your antidepressants. You definitely notice the difference. But if your only other option is not to be able to buy the medication, then this is, like I said, the last resort. So in other words, let's say you're taking 200, milligrams of an antidepressant once a day, then what you would do is you would obviously split that and you'd be taking half that. It's not ideal, but it's better than nothing. Yeah, so it will keep you functional, basically. One thing, obviously, this should only be done with the full knowledge and cooperation of your doctor. Okay, so don't be embarrassed and just not tell your doctor you're pill splitting, because obviously they can't treat you if they don't know all the facts. Yeah,
if they're not up to date, they can't help you.
If they ask how your mood is, and they know you've been splitting pills, and you say not great, then they know what's going on. If however they ask you about your mood and you say not great, and they have no idea that you're pill splitting, then they're not going to know what's going on. I mean, it seems kind of obvious, but this is your doctor is your partner. You need to be completely open and honest with them, or else your treatment is just not going to work. There are some things to keep in mind about pill splitting. First, the FDA does not encourage the practice, but however, they do actually have an article on their website about pill splitting. So take that as you will. I think they wanted to say, if people are going to do it,
if you need to.
But they have the tips. And so a lot of information about that is, I'm going to put a link below to an article I wrote a few years ago that has some do's and don'ts about pill splitting, but I also would definitely recommend looking at the FDA website, and we'll have the link to that too.
They're definitely more qualified than us.
Yes, yeah. Therapy is probably the most expensive part of depression treatment. And you might be tempted to just let it go by the wayside when you don't have the money.
You might want to just say, hey, well, talk therapy. It's just talking. It's not that important.
But it's especially important, for instance, for people with anxiety or who have depression that is responding to cognitive behavioral therapy. You don't want to just cut that off. So the ideal thing is, if you're already in therapy, is to talk to your therapist. For instance, if your therapist has been billing your insurance, then there's a chance that if they don't have to go through your insurance, chances are they will probably charge you much less. So, for instance, doctors, if they charge $150, for them not to have to go through insurance and everything, they might be willing to take $50 per session. I know if you don't have a lot of money, that still sounds like a lot, but if you cut your therapy down, your number of visits, and try to do as much kind of homework, in the meantime, then you still could make progress. The other thing, of course, is, as I said, is to see about the mental health clinics that operate on a sliding scale. If you have a therapist who is not willing to, who knows your situation but is still not willing to play ball, then that's when you
they're not a very nice therapist.
Yeah, I mean, if they're not even willing to not go through insurance and take a lower amount, it's really silly, because therapists and all doctors spend a lot of time dealing with insurance companies, and just the time that they won't have to do that. They're not fun
to deal with.
Yeah, just the time that they wouldn't spend to do that is really worth the $100. So, or 2/3 or whatever. However much. But let's say you don't have a therapist already, and you're not in a situation where you can pay anything. There are some options, but you need to be careful with these. So, for instance, there are support groups. If you're dealing with any kind of abuse, PTSD, then there are groups that definitely are geared toward that, and a lot of them are online. If you're just dealing with your garden variety depression or anxiety, there are support groups. But you have to be careful, because especially with online groups, there can be a lot of misinformation. So you want to be very, very careful about the information you receive. But it's kind of worth it if you're getting support. Another option is, if you live near a college or a university, they might offer. So, for instance, I work at UC Berkeley, and they have the psychology department has programs on a frequent basis where they are doing free therapy. So that's something, now granted, you're probably going to then have the therapy with someone who is still getting their graduate degree.
Yeah.
I can't imagine you would be dealing with someone who hasn't even gotten their undergraduate degree. So that's something to keep in mind. But if you're not getting therapy at all, it's definitely worth a shot.
Yeah, if you're not getting it at all, it's not going to be fun.
Yeah. The other possibility is spiritual counseling. There are a lot of pastors and ministers who actually are qualified as therapists. So this is something, again, to be careful of. If your church is obviously, is it one that's not really accepting of mental illness or tells you just to pray or whatever, that's not going to work. But,
and if it's, maybe if you're something like LGBT and they're not very accepting of the LGBT people, that's something you need to be aware of.
Yeah, I mean, you probably have a pretty good idea of that. But remember, it doesn't have to be at your church. There are other churches you can go to, and
in fact, it might be better to not be at your church.
Yeah, you might.
Because then you get somebody who doesn't, you aren't seeing. I forgot what my point was.
That there could be conflicts.
Yeah.
That you could run into some problems. So
I'm pretty sure there's rules against treating people that are like. Isn't there?
What?
Rules against treating people that you have actual relations to in some way?
Well, in most cases, like if you were not dealing with a spiritual counselor, yes. But if you are dealing with a spiritual counselor, then there's really no way around that. Anytime you go to a therapist, there's a lot of things to be aware of, but that's obviously is a situation in which you have to be more careful, and more aware of whether you're getting good advice from them. As Lauren said, for instance, if you're LGBT, you have to be aware of the spiritual leaders' beliefs. Obviously, you probably know whether the situation's right, although you never know. It's one thing to listen to a sermon, and it's another thing to actually getting therapy from someone. So your last option for therapy is definitely probably the one I would consider last, which is self-help. So there actually are some good books out there about cognitive behavioral therapy, kind of do it yourself, about depression, about anxiety and how to handle it. The thing is obviously you can find, Lawrence could probably tell you how to get free PDFs of any book online, but which we're not going to cover. But if you can't afford the books, find look at the Amazon reviews. Find a book you're interested in, and then that person may actually have a website, and they may have links that are helpful, because a lot of times they want to create a robust community around their book or books. So I've actually gotten a lot in the past from self-help books. You just need to read the Amazon reviews, and if someone says, oh, this person's just full of it, or they're pushing some kind of agenda, then obviously they're the ones to stay away from. But also there are some good articles online. Generally what you're going to need if you're doing it yourself is some good pages or books, web pages or books that have exercises that you can do to work through things. So that's something to be aware. If it's just you reading something, it could be helpful, but it's probably not going to do a fantastic job. Obviously, we've just really, skimmed the surface of a lot of this, which is where the links come in. One thing also that we're probably going to cover is arguing with your insurance company, because this is during these times when the insurance companies are losing a lot of money because of COVID, they're probably going to be even tougher than usual as far as paying stuff. And I did write another article because I worked at an HMO in the support. Well, I worked sitting next to the customer service people. So I learned a lot about how to get your way, if possible, in dealing with an insurance company. So I'll put a link to that article too, because as I said, I did that in that particular position for a couple of years, and I overheard a lot of stuff.
Right. Well, we hope that you've enjoyed this video and found it helpful. If you did, you can give it a like. If you didn't, give it a dislike. If you'd like to say anything at all, you can leave it in the form of a comment. And if you'd like to see more, you can subscribe. But in any case, we hope that you have a nice day.
Take care.